So I very much appreciate everybody coming out today. I'm Stevens Mundy, and I'm the president of CVPH and Community Providers. And we're really excited to be here to talk about the recognition that our staff have gotten for just a tremendous job in our cardiology services. We've got a couple people who are gonna say a few words, and then we'll all be available for the folks in the media that if you have questions you want to ask us, we're happy to do that. We have a dedicated team of cardiologists and employees here that come to work night and day, doesn't matter the hour, and bring a level of quality and care to our community not found in many areas. In fact, 90%, we're in that top 10%, which we're thrilled about. Yesterday, just to bring this point home, someone I know here in the community was a patient here and sent me an email last night, and I'd just like to read a piece of it. It says, "I was also pleased to find the hospital staff let their humanity show through and seem genuinely interested in me as a patient as well as a person." And I thought that really summed everything up as I was thinking about today. Our Heart Center continues to excel in what we do, and we're very lucky to have this program here. I think all of us in the community, as we approach the time in our life where we might need this, it's even more important. We, on an annual basis, perform over 3,500 interventional and invasive procedures. After we move 100 open hearts to Fletcher Allen and Burlington, and we shift 200 plus angioplasties, electrophysiology cases, and other diagnostic procedures back, we'll be approaching 4,000, which is really an exciting thing for us. We provide this full range of services through this team of dedicated caregivers. Sorry. As part of the plan developed across our system, we will see more and more cases from northern New York. We're working very closely with our partners in Burlington, with our partners in Malone, with our partners in the St. Lawrence Valley, and other areas of northern New York. And we'll be seeing more and more cases come here, which is really exciting because we can look at those patients, we can look at those physicians, we can look at those families and say, we're the best. We're absolutely the best. And a couple other people are going to echo these points, but I think that's the takeaway, is that we're proud of the Healthgrades recognition, not because we got recognized, because it says what we do every day, what the people you see here that are in. There are others that were here last night and are sleeping. And that's the way it works. And that we're truly pleased with that. But I'd like to call on our Assemblywoman GN Dupree to come up and just say a few words. Jan's no stranger. She's been a board member, a board chair more times than I can even count because I never get it right.
It's okay.
But I'm thrilled to have her here today. So Jan, thank you.
Thank you. I'm so happy to be here and to always be invited back to these events. I've been around long enough at this hospital that when I was chairing the board, we were told that first we couldn't get any heart. I'm sorry, I've had a long night. We couldn't get a heart section at this hospital. They would not allow one. The state health department wouldn't allow it. And if we did, it wouldn't be successful. Well, I got to tell you, these folks over here and this administration certainly has proven that all wrong. What a tremendous facility we have here, how proud we are of it, certainly as a community. My husband liked it so much the first time, he came back a second time. And they did just as well, if not better, the second time. So we're trying to prevent a third, but that's okay. It truly, we can say from very personal experience, the care, the compassion, from the time he came into the ER until he was discharged was just phenomenal. And I know it's that way with everybody who has the good fortune and the misfortune both to be here and be treated. It's not something anybody wants, but if it's going to happen, how fortunate we are to have it right here in our community of Plattsburgh with outstanding staff to take care of our constituents and our patients. So thank you all for the great job that you do. Thank you, Stevens, for you and all of your administration for what you do to keep making this hospital better and better.
Okay, and thank you so much for being here. So at this point, I'd like to turn the podium over to Bob Donahue. Bob is with Healthgrades, is the organization that bestows this award each year on organizations across the country. And he wants to talk to you a little bit about the award, the methodology, the data sources, et cetera, and really why it's so meaningful. So with that, I'd like to welcome you to Plattsburgh. He flew in from Boston this morning to Plattsburgh International, so we're thrilled about that.
Yep. Thank you very much. I'll say about 2 sentences, and you'll figure out. Yeah, I'm from Boston. But anyway, thank you. It's it's a pleasure to be here today. And just to start off, I'm going to let you know that every day at Healthgrades, we focus on providing patients with tools and information to make a very important decision, an informed decision, and that's where to seek medical care. And in each year, over 225 million visitors access our online tools to do just that. Our teams analyze the clinical outcomes of almost 4,500 hospitals in the country each year across 28 different conditions and procedures. And when we analyze clinical data, we're focused on 2 very key items. We look at, during the hospital stay, mortality rates and complication rates. And we believe that these are the 2 most fundamental, relative, objective measures of quality. So simply put, if a patient is treated at Champlain Valley Physicians Hospital, we're looking at, number 1, did the patient survive the treatment of care and for a set period of time following that care? And number 2, did the patient experience any unexpected health issues while in your care? To ensure our process is transparent and fair, we provide the detailed analysis and ratings. We provide the details behind our analysis and ratings in each report. We have an annual report each year, and also on our website and the Quality Center. And I'm here today with all of you to share the outcomes of a recent analysis where we looked at the top performers in the nation for cardiac care. I'm pleased to announce that Champlain Valley Physicians Hospital is a recipient of this distinction, this award, and it's not by accident at all. The achievements, just in fact, following the past year, and I'll read these from these ratings. One of America's 100 best hospitals for cardiac care in 2014. One of Healthgrades America's 100 best hospitals for coronary intervention for 3 years in a row. Recipient of the Healthgrades Cardiac Care Excellence Award in 2014, which means they're ranked in the top 10% in the nation. Recipient of the Healthgrades Coronary Intervention Excellence Award for 7 years in a row. So ranked in the top 10% by us for 7 years in a row there. Ranked among the top 5% in the nation for cardiology services in 2014. Ranked among the top 5% in the nation for coronary interventional procedures for 3 years in a row. 5-star rated, a 5-star recipient, and just touch on our ratings. Our ratings are either a 1, a 3, or a 5-star for different cohorts. A 3-star means, and that's the majority of hospitals fall in the 3-star category, it means that the hospital is performing as expected based on our methodology. And I want to point out that we take into consideration the community's health, so we risk adjust to allow hospitals to treat a more elderly population, to allow hospitals to treat more patients with underlying conditions, so we can compare it fairly. So that 5-star rating is the highest. That means the hospital is an outlier. does above and beyond and significantly better than what's expected based on the patient you treat. So 5-star recipient for coronary interventional procedure for 7 years in a row, 5-star recipient for treatment of heart attack in 2014, 5-star recipient for treatment of heart failure in 2014. So there's a wide range of areas where this hospital is performing just outstanding. So, and I know that these recognitions are a real tribute of the effort that Champlain Valley Physician Hospital's dedicated team, staff, physicians put into this focus that they put into their care every day. And we know that your staff and your patients, your community will applaud these recognitions. Today I'd like to add Healthgrades to that list as well. And I'm really pleased to present this hospital with this award. Outstanding performance in cardiac care.
Thank you very much. Appreciate that. Yep, good, thank you. Well, let's get a workout with that.
It's heavy.
Okay, let me put that over. So that concludes the prepared remarks that we have. We would very much like to have, we've got some of our medical staff here, some of our employees that are just, they do this work all the time, and we're so thrilled to have them and recognize the work that they do. And we're happy to take questions either here or individually, as you may like. But please join us in recognizing them for the great, outstanding work they do. So thank you very, very much. Happy to take questions now or individually, however you like to do it.